Welcome to Just-in-Time CME, a YouTube-based video CME program hosted by the Children's Hospital and Medical Center in Omaha, Nebraska. Today's video refers to the diagnosis and care for a newborn found to have a hemoglobin variant on newborn screening. Per ACCME guidelines for enduring internet-based CME materials, the review date, release date, and expiration date for this video are listed here. This research project is supported by a grant from the Genetic Services Branch of the Maternal and Child Health Bureau. This project has also been approved by the Institutional Review Board at the University of Nebraska Medical Center. CME credit is available. To claim these credits, you must be a physician licensed in Nebraska or one of its surrounding states. You may claim this credit only once, but you may watch this video as many times as you need. To claim credit for this video after watching it, go to www.childrensomaha.org/medical-education, all one word, and follow the links. We'll have that website for you at the end of the video as well. I'm Dr. James Harper. I'm a pediatric hematologist, and I am consultant to the Nebraska Newborn Screening Program. My email address is listed here in case you have questions. I have no pertinent disclosures. The objectives for these talks are listed here. Variant hemoglobins are rarely clinically important, and the purpose for evaluating these is that some of these variants do have clinical significance. They can either harm the child directly by causing tissue hypoxia either because of anemia or because of decreased effectiveness. They can also interfere with other lab tests. Examples of clinically important variants found here in Nebraska include hemoglobin Hammersmith, which is associated with severe hemolytic anemia, and hemoglobin J Baltimore, which is known to interfere with hemoglobin A1C measurements. In the testing of these children, these babies have already had their newborn screen, which has shown the abnormality. They therefore move on to the next step in which they are confirmed, and this is obtained through one of the regional lab here at the Med Center or one of the other labs. And through the regional lab, this can be ordered as hemoglobin confirmation newborn. In later life, evaluating untested siblings or evaluating parents, 3 labs are done: a CBC and retic, a ferritin, and a hemoglobin electrophoresis. And again, these labs can be obtained through the regional lab, Mayo, ARUP, or one of the other reference labs. Interpretation of these results typically are FAV, in which you have fetal hemoglobin, adult hemoglobin, and the variant hemoglobin listed in descending order of concentration. Normal fetal and adult hemoglobin account for the majority of the baby's hemoglobin, and this pattern is most consistent with a variant trait. FV can be seen in when there is fetal and variant only. These are typically homozygous variants or laboratory error. A premature infant would also have to be considered for a gamma chain variant, which would of course have little or no significance later in life. These variants are passed on in an autosomal fashion, so one parent will have this, and each pregnancy has a 50% risk of inheriting the abnormal gene. Each pregnancy has no impact on the future pregnancies. This risk is independent of their outcome. In this case, the mother was the carrier, and her first daughter was non-affected. Her second son was affected. Her third child, her second son, was unaffected, and her fourth child was affected. So where can I go for information on this? The American College of Medical Genetics, and their website is here, have a home for newborn screening. And you can follow the links to the Education Center and the Publication Center. And the Publication Center has the practice guidelines needed. From here, you can obtain the Newborn Screening Act Sheet, which you may have obtained from the Newborn Screening Program in their mailing to you. And this is an example of the ACT sheet for the FAV pattern. This includes a differential diagnosis, a condition description, steps to take now, and then laboratory studies and referral sources are listed here. So recommended actions regarding a newly discovered newborn. You should take the following actions now. First, you should contact the family to inform them of the result and to reassure them that these individuals usually do not have clinical problems, as most variant hemoglobins are not clinically important. You should do a CBC and retic on the baby now, and then again at 6 months. You should order the hemoglobin confirmation study, again, through the regional lab here at the Med Center. It's hemoglobin confirmation newborn. You should offer family members referral for genetic evaluation and counseling, particularly in the case of a clinically significant variant hemoglobin that would have impact on adult care for the parents. And then you should report these findings to the newborn screening program. American College of Medical Genetics also has diagnostic evaluation algorithms published, and this is an example of one for hemoglobinopathies. The study for the newborn screen is abnormal. The confirmatory test is also abnormal, and in this case we will follow the path for FAV. We'll do the CBC, and if the child appears to be anemic for age, then we will refer to a hematologist for further evaluation and treatment. If they are not anemic, then we will do no further testing on the child, but we will offer the family genetic counseling. Parental testing can be done, particularly in those hemoglobin variants that can affect other laboratory studies, such as hemoglobin A1C measurements. And the studies would include, again, a CBC and retic, a ferritin, and a hemoglobin electrophoresis, and then genetic or hematologic counseling as needed. So guidelines for parents. Children with variant hemoglobin traits are most commonly unaffected. Most of these have no clinical importance. Those few that have clinically important variants warrant referral to a hematologist. For those variants that can affect other labs, documenting parental status is helpful, not only for the family planning benefit, but also the parent's personal health. You should advise the parents to write this information down in their child's baby book or other record, so that when the child is older, they'll have a clear idea of what issues that child or their grandchildren will be facing. Well baby, well child, and immunization schedules are normally unaffected by this finding. You can obtain more direct information here in Nebraska by calling the Nebraska Newborn Screening Program at 402-471-0374. Hematology consultation may be obtained from 402-559-7257. Genetic counseling appointments can be arranged through 402-559-6418. Thank you very much for your attention. Your feedback regarding this video is highly appreciated, particularly in the light of this being a research project. We are looking for detailed feedback as much as we can get. We also want to know what topics you would request. And to learn about other CME activities at CHMC and to register for CME credit, please go to childrensomaha.org/medical education.